Good morning. Today's topic for discussion is bone. Bone is the hard form of connective tissue that constitutes the majority of the skeleton of most vertebrates. It is second only to cartilage in its ability to withstand stress. Bone may be classified in several ways: developmentally into endochondral bone and intramembranous bone, histologically compact and spongy bone, and by shape long bones, short bones, flat bones, and irregular bones. Histological classification: the compact bone is composed of dense and concentrically arranged bony trabeculae or lamellae. These are more solid with fewer cavities, found external to spongy bone, and they have Haversian system. Spongy or cancellous bone is composed of bone trabeculae or spicules. It has a simple and less organized architecture. It has a lattice work pattern with numerous small cavities, and they are found internal to compact bone, and they have no Haversian system. In the macroscopic classification, the immature bone or fibrous bone have more cells and fibers in them. In humans, they are found only in fetus, sockets of alveolar bone, and sutures of the skull. The mature or lamellar bone, this is the type of bone which are composed of thin plates, that is lamellae, of bone tissues, and these are most mature human bones and are also known as lamellar bones. The functions of bone. First is they provide support or the framework to anchor all soft organs. Second one is protection, as skull and vertebrae surround soft tissue of the nervous system, and the ribcage protects vital thoracic organs. They provide movement, as skeletal muscles use the bone as levers to move the body. For storage, the fat is stored in the interior of the bones, and the bone matrix serves as the storehouse for various minerals. In blood cell formation, the hematopoiesis occurs within the marrow cavities of the bones. Composition of bone. The bone is mainly composed of 65% of inorganic matter, that is mainly hydroxyapatite, which is mostly calcium, and inorganic orthophosphate deposited between collagen. 35% is organic, 28 to 30% is collagen, and 5 to 7% is non-collagenous proteins. The osteocalcin, bone siloprotein, phosphoprotein, osteonectin, and bone morphogenic protein. The two-thirds of the matrix is inorganic, which is mainly composed of calcium and phosphate minerals, along with hydroxyl, carbonate, citrate, and trace amount of other ions, such as sodium, magnesium, and fluorine. The organic matrix of the bone. Bone is formed by the hardening of the matrix, entrapping the cells. When these cells become entrapped from osteoblast, they become osteocytes. The organic matrix of bone is about 90% collagen and 10% non-collagenous proteins. The collagen contributes towards the important biomechanical properties of tissue in terms of resisting loads and providing necessary resilience that prevents fractures. The dominant collagen in bone is type 1, intrinsic collagen secreted by the osteoblast, and the extrinsic collagen is formed by adjacent fibroblast. Non-collagenous proteins of bone. These are heterogeneous group which vary from entrapped serum protein to glycoproteins. They play a role in mineralization. The main non-collagenous proteins comprise of proteoglycans, osteonectin, osteocalcin, glycoproteins, bone morphogenic proteins, and bone sialoproteins. The alveolar bone. Alveolar bone or alveolar process is that portion of maxilla and mandible that supports the roots of the tooth. If the teeth are lost, the alveolar process disappears. It is composed of two parts, the alveolar bone proper and the supporting bone. Since the alveolar process develop and undergo remodeling with the tooth formation and eruption, they are tooth-dependent bony structures. Alveolar process contains a region of compact bone that is adjacent to the periodontal ligament and is called lamina dura. It is called processus alveolaris in maxilla and pars alveolaris in mandible bone. The lamina dura, it is attached to the cementum of the roots by periodontal ligament. It is the bone lining the alveolus, and in clinical radiograph, it commonly appears as dense white line, as we can see in this picture. This arrow is representing the lamina dura in clinical radiograph. Development of alveolar bone. Alveolar bone develops from the dental follicle. The ectomesenchymal cells of the dental follicle differentiate into osteoblast and lay down the matrix called osteoid. Some osteoblasts become embedded in the matrix and are called osteocytes. In this picture, this A alphabet is representing the enamel organ, B is the dental papilla, and C is the dental follicle. And it is the dental follicle that is responsible for the development of the alveolar bone. Now, near the end of the second month of the fetal life, mandible and maxilla form a groove that is open toward the surface of the oral cavity. As tooth germs start to develop, bony septa form gradually, and the alveolar process starts developing strictly during tooth eruption. Now, functions of alveolar process, it supports the tooth roots on the facial and on the palatal or lingual sides. It is the one that is responsible for the separation of teeth from mesial to distal and is also contributes to absorption and distribution of occlusal pressure produced in tooth-to-tooth contact. Structural element, these are mainly composed of bone cells, bone matrix, Sharpie's fibers, vascular supply and lymphatic drainage. In bone cells, there are osteoprogenitor cells, which are stem cells. Osteoblast, they forms the bone. Osteocyte maintains the bone. And osteoclast resorbs the bone. Osteoprogenitor cell, these are stem cells derived from the mesenchyme. They possess mitotic potential and the ability to differentiate into mature bone cells. They resemble mesenchymal cells and are spindle-shaped with pale staining, elongated nuclei, and sparse cytoplasm. These are mostly found in the inner portion of the periosteum, in the endosteum, and within vascular canals of compact bone. Osteoblast. These are uninucleated cells synthesize both collagenous and non-collagenous bone proteins. They also synthesize the enzyme alkaline phosphatase, which is needed locally for the mineralization of osteoid. Precursor of osteoblast is the preosteoblast, and the osteoblast have all the characteristics of hard tissue forming cells. When the bone is no longer forming, the surfaces of the osteoblast become inactive and are called lining cells. Osteocytes. These are osteoblasts secreted in the bone matrix that are entrapped in lacunae. An osteocyte lies in its own lacunae and contacts its neighboring osteocytes cytoplasmically through canaliculi. Most important function of osteoblast to osteocyte complex is to prevent hypomineralization of bone by continually pumping calcium back to the bloodstream. Osteoclast cells, these are derived from a monocytic macrophage system which are responsible for bone resorption. These are multinucleated cells with fine finger-like cytoplasmic processes and are rich in lysosomes that contain tartrate-resistant acid phosphatase. Osteoclasts lie in resorption craters, which are known as Hauschup's lacunae on bone surfaces, or in deep resorption cavities called cutting cones. These bone cells can only resorb mineralized bone matrix. Now, the bone matrix, this consists of organic and inorganic components. The association of these substances gives bone its hardness and resistance. The organic component is composed of collagen fibers, with predominantly type 1 collagen, and amorphous material, including glycosaminoglycans that are associated with proteins. Osteoid is uncalcified organic matrix. Inorganic matter represents about 50% of the dry weight of bone matrix, and it is composed of abundant calcium and phosphorus, as well as smaller amounts of bicarbonate, citrate, magnesium, potassium, and sodium. Calcium forms hydroxyapatite crystals with phosphorus, but is also present in an amorphous form. Concentrically arranged bony lamellae. These gives the types of layering to the lamellae. First is circumferential lamellae, that is present external or internal. Then concentric or Haversian lamellae. Then interstitial or intermediate lamellae. In this picture, we can see here, this is the osteome, that is the Haversian system. These are circumferential lamellae, which are present in the periosteum. These are concentric lamellae forming the osteome. These are interstitial lamellae between the two osteon, the blood vessels within Volkmann's or perforating canals, and the blood vessels within Haversian or central canals. These are the lacunae containing the osteocytes. External circumferential lamellae or periosteal lamellae. These are continuous, uninterrupted layer found immediately beneath the periosteum around the circumference of the bone. Internal circumferential lamellae or endosteal lamellae. These are continuous, uninterrupted lamellae immediately surrounding the central medullary cavity. Concentric or Haversian lamellae. These are layers of bone surrounding the Haversian canal. These varies from 5 to 20 layers. Interstitial intermediate lamellae, these are found in between Haversian system, triangular or irregularly shaped groups of parallel lamellae. They may represent lamellae left by former Haversian system, destroyed during growth and remodeling of bone. The Haversian system, this is composed of small central canal, that is the Haversian canal, which is in constant communication with the blood vessels. Surrounding the canal are concentric bony lamellae, which are called Haversian lamellae. There is a bright thin line called cementing line that separates one Haversian system from another. Haversian system or osteon are found underneath the periosteal lamellae. Bookman's canal, the canal that are not surrounded by bony lamellae are Bookman's canal. They traverse the bone in a direction perpendicular or oblique to the lamellae. These are larger than Haversian canals. Sharpie's fibers. Sharpie's fibers are basically the terminal ends of principal fibers of the periodontal ligament that insert into the cementum and into the periosteum of the alveolar bone. Vascular supply of alveolar process of maxilla is by anterior and posterior alveolar arteries, and the alveolar process of mandible is supplied by inferior alveolar arteries internally and periosteal branches of submental and buccal arteries externally. The lymphatic drainage, smallest lymph vessels drain into lymph capillaries. All third molars drain into jugulo-digastric lymph nodes. The mandibular incisors into submental lymph nodes and rest in submandibular lymph. Now comes the gross morphology. The alveolar socket, that is also called as dental alveolus. These are the sockets in the jaws in which the roots of teeth are held in the alveolar process with the periodontal ligament. The interdental septa means the fence or wall. These are the plates of bone that separate each individual socket from one another. The interradicular septa, these are the thin plates of bone that separates the roots of multi-rooted teeth. Cribriform plate is also called as bundle bone. This is a type of alveolar bone, so called because of the bundle pattern caused by continuation of principal fibers into it. This is the compact layer of bone lining the tooth socket, and it reflects a sieve-like appearance produced by numerous Volkmann's canals passing from the alveolar bone to the periodontal ligament. And there are numerous Sharpie's fibers also pass through it. The structure of the alveolar bone. The outermost portion is the cortical plate, a central spongiosa, and a bone lining the alveolus is the bundle bone. Cortical plate. Cortical plate is the outer bony plate of varying thickness, which is the outside wall of the maxilla and mandible and is covered with periosteum. This is continuous with the lamina cribriformis at the orifice of the alveoli, that is alveolar crest. This consists of Haversian systems and interstitial lamellae. This is thicker in the mandible than maxilla and generally greater on the lingual than on the buccal or facial aspect. Spongiosa are spongy bone between the two bony plates and between the lamina cribriformis of adjacent teeth or roots. This consists of delicate trabeculae between which are marrow spaces filled mostly with fatty marrow, regions of maxillary tuberosity and the angle of mandible. Alveolar bone proper. This is the compact bone that composes the alveolus. It is inner, heavily perforated bony lamellae forming the alveolar wall. In radiograph, this appears as radio-opaque line distinct from the adjacent spongiosa, that is lamina dura. Contains osteons like other cortical bone but is distinguished by the presence of bundle bone. Periosteum and endosteum. Layers of differentiated osteogenic Connective tissue covers all bone surfaces. Tissue covering outer surface of bone is termed as periosteum, and the tissue lining the internal bone cavities is called endosteum. Periosteum consists of inner layer composed of osteoblast that is surrounded by osteoprogenitor cells, and outer layer which is rich in blood vessels, nerves, and composed of collagen fibers and fibroblasts. The endosteum is composed of single layer of osteoblast and sometimes small amount of connective tissue. Histologically, here we can see the histological picture of cancellous bone, in which we can see the connective tissue portion is more in compared to the hard tissue. And here in compact bone, this is the bony part, and this is the connective tissue part. These are the main differentiating features, and in higher magnifications also, we can see the lacunae and the osteocells. So here it comes the end of this lecture. Thank you.